You're watching Capital Connection from the Illinois State Capitol.
Welcome back. Now, Governor Pritzker officially signed his new health insurance reform policies. We had the new acting director of the Illinois Department of Insurance on a few weeks ago to break down some of those reforms. Joining us now is Laura Minzer with the Illinois Life and Health Insurance Council, representing health insurance companies across the state. Laura, thank you so much for joining us.
No, thank you for having me, Cole. Pleasure to be here.
Now that this has been passed and the reforms are going to go into effect,
Yep.
I want to start with just the implementation of this and what
Sure.
this really looks like going forward. Is this going to be something that maybe people at home are going to see some big changes to their plans, or is this going to be more of a slow rolling process?
So I think excellent question. It's going to be a process. There certainly will be some changes coming into the mix here, effective January 1st of 2025. So coming up fairly quickly, that consumers will see kind of readily available in the market. So specific to, you heard a lot about provider directories and the information that insurance companies are supposed to have in those directories in terms of who is in my network, who's no longer in my network, so the accuracy, making sure that those directories are reflective of the actual doctors in your network. And if they are not, then the department has some tools in their toolkit to make sure they enforce those mechanisms. So that will roll out in 2025. You may not see it immediately, but it certainly will be components of your plan and the transparency components. When consumers go to shop for their insurance beginning in 2025, so open enrollment begins for the 2026 plan year, that's when you're going to see a lot of the changes with respect to what the benefit plans are required to do taking effect. So an example of that is when I go shop for my insurance, what kind of pharmacy prescription drugs are covered and what are my costs going to look like? Maybe I'm somebody that relies on those benefits more so than another consumer. So for those types of kind of shopping tools and experiences, that will be more looking towards the next fall open enrollment period. But certainly from a consumer-facing perspective, those are things they can look forward to.
I know at the end of the session, a lot of the discussions around this, there were a lot of questions on potential price tags for something like this. It's been almost a month now. Mm-hmm. I wonder if there's been any clarity from the industry side on this?
I think with respect to that component, first and foremost, our goal always, as we talked with the governor's office and appreciated the partnership and the discussions we had around implementation and in downstream impact, one of those aspects was how do we balance against the cost impact of this as well. So key for us is giving us, from the industry's perspective, time to kind of digest the changes. So for example, step therapy you heard a lot about. So how insurance companies apply step therapy with respect to your prescription drug benefits, your provider or your doctor prescribes something, the insurance company, beginning in January 1st of 2026, can no longer say to that doctor, we suggest you go to a different clinically appropriate medication. Your doctor makes that decision with you and the patient. So that's an example of things that will take effect. Initially, the concerns we raised as we discussed was that those components would take effect in 2025. And that would have been very difficult in terms of understanding, okay, what is utilization going to look like and what is the cost going to look like? And so now we have time to kind of look at that, the industry can look at that and hopefully get it right in a way that consumers aren't going to feel the impact in their pocketbooks as much as they would have.
You've talked about that process of shopping for insurance and when that's really going to change. And I wonder with that, are those changes going to be seen on the nitty-gritty level on this, or is this going to be something that's pretty forward-facing that people may see in one way or another? Or is this are these changes, like you were just kind of addressing, that people are going to see when they actually start maybe needing the care?
So great question. I think it depends on what type of plan you have. So it's really, really important to kind of think about this, and I believe Acting Director Gillespie talked about this too. The impact of what Illinois can do, whether it's through the Healthcare Protection Act or through other type of regulatory changes, statute changes, can only impact those plans that are regulated by the state. So if I'm a consumer that purchases a plan on the ACA marketplace, then I am going to likely see changes. If I'm someone that doesn't regularly rely on medications or prescription drugs, I may not see that as much as somebody that does. Prior authorization for inpatient hospitalizations for mental health, for example, again, a very specific consumer, kind of specific need. Obviously, most people, you would hope, if they have a health plan, they're going to a doctor regularly in their primary care. We heard a lot about that in recent years about contract changes and disputes between different providers, and the protections there that exist for consumers if they suddenly find that even their primary care doctor is no longer in the network. So making sure from a consumer perspective there's more visibility on that. But it also depends on what kind of plan you have as a consumer. So going back to your question on implementation, key for us is going to be kind of the education process, and we look forward to working with the department on this too, because not every consumer is going to benefit from the changes in the Healthcare Protection Act in the same way that other consumers will.
I wonder with this, the plan will affect those plans that the state can only regulate. And how different does that make these state regulated plans compared to ones that may only be regulated by the federal government? I know there were already existing state regulations, but does this kind of bridge that gap, or not bridge it, but expand that gap a little bit more?
That's a really good question and a really tough one to answer. So when you think about the plans that are regulated by not regulated by the state, meaning they're self-insured. So typically it's your employers, big union plans. They call it what's self-insured their benefits. So essentially, your employer is the one that owns the risk of that relationship. So they're the ones designing the benefits, just determining what components should be offered, what's going to be helpful to their population, their employer base. Obviously, if there are rules that they have to comply with, so it can vary greatly. And even within our own public plans that we have here, state employee being a good example of that. Within the state employee group health plan, you have the self-insured, where the state owns the risk, and unless they're specifically folded in some parts they are in the statute, they are not going to be included in some of the changes. And other changes where the fully insured or the state regulated plans, mainly the HMOs that are a part of that, they will be. So I think there's a couple of things to think about is that, yes, it could bring them more in line, but sometimes there are some changes that could be confusing to consumers, thinking they have changes that they don't have within their benefits. Also, I think we also have talked to provider groups as well, and making sure they understand how some of these changes will impact their practice and who's walking through the door, and who's no longer subject to step therapy versus who may still be held to some step therapy requirements.
One of the more drastic changes as a part of this was the ban on the short-term health insurance plans. The state has started to call them, has been calling them junk insurance plans. When I had Acting Director Gillespie on, we talked a lot about that, and the word that got thrown around a lot at the end of session was that these were deceptive. That got thrown around in committee. I know we discussed it on the show as well. And I know there are quite a few people with these plans in the state. When do they need to know, or when those are gone, and what are the avenues that they should be looking at?
Sure. Shortly to your question of when their ban takes effect January 1st of 2025. So coming up very quickly. To back up a little bit, we believe and still maintain to this day that unfortunately with the ban on short-term limited duration insurance, and we take a little bit of exception to the description that they're junk, we prefer to call them a sort of gap. I mean, it's key to remember what these plans are. They are very short-term. They are designed to fill a gap in your medical insurance costs should you find yourself with, between larger comprehensive health insurance, maybe you're changing jobs, maybe you, for whatever reason, have a month in time where you're coming off student insurance or your parents' health plan, and you haven't quite found the right fit for your comprehensive health insurance. These plans are not intended, nor should they ever be marketed as such, as a replacement or in any way a suitable alternative to your comprehensive health insurance policies. They are designed specifically as a catastrophic gap type of policy. So unfortunately, there will be consumers that will lose that option, and they will not have another type of viable alternative for filling a short-term gap in that way. And we did continue to oppose those provisions because we had really hoped that the administration would work with us to address the concerns they had, that in some ways these were being deceptive or being used as deceptively. The Department of Insurance does approve these products, so they have the ability to approve these products before they're ever marketed and sold. If they believe that there are bad actors in the marketplace that are using deceptive tactics to market products that suggest they're doing one thing when they're actually really designed for another purpose, then we really believed that there was an opportunity to give them more authority to go after those bad actors and not let the bad actors determine how the market should look in Illinois when you have good actors that are just trying to sell another medical insurance option to consumers. So we look forward to conversations with the department about how they are communicating to those consumers currently when they lose coverage. Now, they would say that I think that it's intended to line up with some changes that are taking effect in the federal level beginning September 1st. But again, what options are going to exist for that specific population that relies on these types of alternatives going forward when those don't exist? That will be key for us.
Why, when asked about that gap and what the other options are, we often heard about the Affordable Care Act and the federal options that are available. Why is that not suitable for those kinds of gap? And why is that not a good answer?
It could very well be, but I'll give you an example. So, the example we used is an individual who perhaps is changing jobs. You typically are offered what is known as continuation of coverage, or more colloquially known as COBRA. COBRA, for anybody that's had experience with COBRA, it is basically your employer's plan, and you're just taking over the premiums for that period of time until you start a new job or until you get another comprehensive health coverage to replace that. For anybody that has a family or a dependence on that, that can be a pretty costly endeavor. So easily upwards of $1,000, if not more, each month. Some people find that they cannot continue to pay those premiums for whatever duration, and so they voluntarily choose not to, which doesn't trigger a special enrollment period, meaning they don't have the opportunity to go to the marketplace and qualify for a subsidy. And they may not qualify for a subsidy. That's the other key component, is that you have populations, you do have consumers that will still pay quite a bit of money for a comprehensive health insurance policy that don't have other types of options available to them. So I'm not disputing the fact that it's not a viable alternative for others, and that maybe they are eligible for Medicaid and they didn't know it, but the fact that they're eliminating an option that consumers do see value in and continue to see value in today is concerning to us.
I wonder, we also, especially in the Senate, when Senator Laura Fine was sponsoring her part of this package, she often talked about how this was a really big step for the state as it moved towards that state-based marketplace. Sure. And I wonder, just from the perspective of the health insurance companies, is that, I know there's a road ahead of us before we get to that kind of idea, but when we hypothetically talk about that, where does that kind of fall in line with all of this, and does that pose more challenges, or is this more potential changes down the road? How does that really...
You mean in terms of the broader package, or just specific to the short-term limited duration?
Just in terms of the broader package.
Yeah. So yeah, I think that's really important to note is that Illinois took the step last year, and the industry was involved in those discussions around transitioning to a state-based marketplace. So basically the state taking ownership over its health insurance marketplace from the federal government, which operates it now. And that transition actually will take place beginning next year. So we're kind of in a hybrid, and then we take over 1/1/26. So with that, from the industry's perspective, we believe that it's really important, first and foremost, we get this right for consumers, that they don't know the difference necessarily in terms of being able to access and shop for healthcare and health insurance plans. But we do believe there's a great opportunity to get more people covered, to have more specific conversations about the populations and the demographics we have that are unique to Illinois, and how do we solve for gaps that we still see in the marketplace. And going back to your question on short term, I think one of the hopes that we had, obviously we had concerns about eliminating that product entirely, was that, hey, look, we are going to be standing up our own state-based marketplace in 1/1/26. It would seem to make sense that if you are going to eliminate this option, at least give us the opportunity where we can design rules around who qualifies for a special enrollment period, and maybe for those that were left out of those options because of federal regulations, we as a state would have the opportunity to bring them into the fold and making sure that truly there is no consumer that is kind of left out of that opportunity. So it is important that I think as we think about alignment, which a lot of these changes in the Healthcare Protection Act will take effect in 2026, we have a lot of work ahead of us, and we look forward to that, but it is important, and all the more important, that we get this right, because we're taking on so much with our marketplace.
Well, Laura Minzer with the Life and Health Insurance Council here in Illinois, thank you so much for joining us.
No, thank you so much for having me.
We'll be right back with Representative Ann Williams to talk about the carbon capture deal that was cut at the end of this spring session. We'll be right back.